Assist, you're having some difficulties.
Okay. Okay.
Good morning.
Good
My name is
morning.
Gina, and I'll be your caseworker here at Tropical Behavioral Health Center. So how are you feeling today?
Tired and it's hot outside. It's just.
Oh yes, the heat really gets and takes a toll on your body.
Yes.
Okay, so before we get started on our intake interview, I would like to inform you that anything said here will be kept confidential. But first, I would like for you to sign this consent form.
Okay.
Sign your name right here, please, Ms. Flores.
Okay.
Okay, and here is also a book of Notice of Procedural Safeguards.
Okay.
Please read after it and look over it. And if you have any questions, please feel free to contact me.
Okay.
My secretary will be giving you my contact information.
Okay.
So keep this with you. And let me have this.
Okay.
Okay. Before I get started with your initial intake, I would like to verify if this information I have here is correct. You're 67 years old.
Yes.
Okay, your current address is still 100 South Benson Road, McAllen, Texas.
Yes.
Okay, and your phone number is still 648-5901?
Uh-huh.
Okay, and your primary disability is diabetes, right?
Yes.
Okay. Do you have insurance?
Right now, yes, I do. I'm not quite sure what it is. The company that we're in, my husband's the one that takes care of that. But yes, so do we need to give you that information right now?
I'll have my secretary handle it outside.
Okay.
That's fine. So we're going to get started on the initial intake interview.
Okay.
If you have any questions, just ask me.
Okay.
Okay. So what brings you here today?
Well, I mean, my amputation, I mean, that's like the main reason I'm here.
And this was caused due to?
Diabetes. I didn't know I had diabetes. I don't really go to the doctor. I've always just done self-medication for myself, and I went due to some pain in my leg, and it turns out that I had diabetes, and I got amputated, which has really affected me. I don't know. It's just I don't want to do anything anymore. The things that I used to, I'm just.
And what were those things that you used to do?
Well, like I mentioned, like my husband, he's retired. We were both retired, so we love to travel. We used to love to travel. We would spend all this time together, go visit my grandchildren, and do all these activities with them, and go. I love to go. Used to love to go shopping with my girlfriends and go out to brunch, and now I can't do any of that. All that is, it's gone. I cannot go out and play with my grandchildren or enjoy a day at the mall with my daughter, or enjoy a brunch and going shopping with my friends anymore.
Okay, let me ask you this. Have you considered or been informed of any assistive technology that you can use?
Yes. What do you mean by that? Like by assistive technology?
Like such as different kinds of devices to help you get around in society.
Mm-hmm.
You could still go shopping.
Yeah. Yeah. Well, the doctor told me about a wheelchair. I don't want a wheelchair. It's too big. It causes a lot of space. People stare. I don't want people always stare at me and why? I mean, I am gonna get a prosthetic leg. I'm scared of that. It's not gonna be the same. I used to like to go buy shoes. Now I can't. I can't buy shoes anymore.
Are you currently receiving any disability-related treatment?
Well, I do go for my checkups, but as far as right now, I'm just pretty much waiting on the time to be able to use get my leg. Yeah.
Okay. And what is your current marital status?
I'm married.
Okay. Do you have any dependent children?
No. All my children are they're married.
Okay. So, how's your home environment like?
Well, it's very peaceful and calm.
It's real tranquil.
Yeah, it's just my husband and I.
Okay. And how do you get along with your other family members?
Oh, great. Everyone's very supportive. I mean, I understand that it's just, I feel like they don't know how I feel. They would have to be put in my situation to understand. They keep on telling me, like, things will be okay. And, all those great words that it's good to hear, but if they don't know what I'm going through, I mean, if they're not in my situation, they don't know what I feel.
Yes, and no one will ever understand how you're feeling.
Mm-hmm.
I understand. What are your daily activities? What do they consist of throughout the day?
After my disability?
After and before. Well, before, you, like you said, you like to go shopping and eating with your friends and getting your nails done, all of that stuff.
Yes.
But now that you just currently had an amputation on your leg, what are your daily activities? What do they consist of?
I just like to be in my house, in my bed. I don't like to go anywhere. My husband, we were planning a trip, but no, I don't want to go. We have to cancel it because it's just not going to be possible. We can't go, and I just want to be in my bed and just enjoy and just be able to feel. That's the only place I feel comfortable, or no one's gonna judge me, or look at me, or that's what I do.
What is your main support system?
The person that's my main support system is my husband. He's there with me 24/7.
And your children, how do they help you cope with this?
Because they go visit me.
And your grandchildren?
Yeah, they go visit me once in a while. I mean, I'm at least 3 times a week or more. Maybe when they're after work, they'll stop by and we'll have dinner together and stuff like that. But I don't know. I don't really like to go and leave the house unless I have to go to the doctor or stuff like that.
Okay. Do you have any unpaid debts?
No, I don't. We have everything covered, our house, or everything. Everything's good.
What are your living expenses, such as medication, costs that cannot be reduced? Does your insurance cover your medication?
Yeah, it covers
medication. So you just have to pay a copay?
Yeah.
Okay, let me ask you this. Have you considered applying to get a provider?
Actually, I've considered because things are very hard around the house. Usually, my daughter-in-laws will go in and help me, or my daughter. They'll go in and help me clean and pick up, just to keep it safe for me around the house.
To keep you busy and to get your mind off of certain things that bother you, do you do little things around the house?
No, I just decide. Sometimes I just go to sleep. It's just, that's what helps me.
Okay. Thank you, Ms. Suarez.
Okay.
This will be the end of our intake interview. If you have any questions, please feel free to contact me. My secretary will help you outside with your insurance and all of that, and she'll let you know. And I'll be seeing you in about a month.
Okay.
For any further initial things that we have to discuss.
Okay.
So it was nice meeting you.
Okay. Nice meeting you.
It was a pleasure. Thank you.
Okay.